My name's Larry Rhodes. I'm a pediatric cardiologist in the Department of Pediatrics at WVU School of Medicine. Not all of us are fortunate enough to have children that are born healthy. It's part of my job to give those parents an opportunity to raise a healthy child. I do what I do because I love children and I love people. It would be my desire that you would not be able to recognize a child with congenital heart disease. That if your kids went to school with a kid with congenital heart disease, that they would not stand out as being different. My primary goal is for the children to be able to go home and have a normal life. I think innovation is just to find a way to either solve a problem completely or to make the problem something that we can deal with. We were created as a medical school to serve the needs of the patients of West Virginia. We train people to be pediatricians, to be pediatric cardiologists, and we've trained some people that are leaders in the field of pediatric cardiology around the country because of what the state of West Virginia has given me. I feel an obligation to give it back to the state. This is where I want to be, it's where I need to be, it's where I belong. I would like to take this opportunity to thank the National Rural Health Association for picking me as Rural Practitioner of the Year. I have to admit that when I first received a phone call about this award, I felt that they had called the wrong person. As many of you know, I'm a pediatric cardiologist that takes care of patients mostly in a university setting. When you work in a primarily rural state, it's sometimes easy to forget that most of us take care of rural patients. I live in a county that covers 650 square miles and only has one high school. I also would like to take the opportunity to thank people that helped me obtain this award. In particular, I'd like to thank the folks that are involved with the West Virginia Institute of Community and Rural Health. Without their support, I would have never been able to receive this award. I'd also like to thank Dr. William Neal, a pediatric cardiologist who established a network of outreach clinics in West Virginia over 40 years ago. Finally, I would like to thank my wife, who over the past 32 years has put up with me moving around and doing this type of work. As many of you know, there are a number of patients in rural communities that need specialized care. We do this in order to keep the patients from having to drive between 100 and 200 miles to come to Morgantown to be taken care of. Once again, I would like to thank the Rural Health Association as well as all those mentioned above in helping me obtain this award. Thank you.